thank you for that kind introduction, and thank you for coming. I'm really excited to talk to you a little bit today about this very large project that I've been working on for now the better half of almost 3 years. It doesn't quite feel like it should be that long, but it has been. The work that I'm going to present today is actually very preliminary, at least the results are, so I'm especially excited to hear your comments, your critiques, and further thinking we should be doing in the area. But quickly before I started, I thought I would take you back to October 2013 and give you a little bit of the impetus and the reason for how we got to where we are and what we're examining. So as you all remember, in October 2013, the insurance markets are starting to open on the marketplace. Just a little bit about my background. I'm a political scientist by training, but I did a health policy research fellowship at the Robert Wood Johnson Foundation at the University of Michigan, where I connected with Sarah Gullist, and I know you've heard her speak already this year. So I will try not to repeat what you heard from her, but maybe just give you a couple highlights of what you heard there. But I was fortunate enough in the fall of 2013, so I've been interested in working with Sarah on health politics issues, so the areas in which health policy intersect with politics, and in particular we got started looking at the HPV vaccine, so I can tell you all about the interesting politics that surround that. But we were looking for other areas to expand our analysis, and of course the ACA is a perfect opportunity for that in terms of the intersection of political communication and health policy research. And so in that fall, I was fortunate to be teaching an advanced lab class where I had 8 students who were devoted to research topics, half of which were working on the election side, which I do, and then the other half were working in health policy. And my project manager and I decided to divide the students up. So October 1st, opening the exchanges, and we decided, let's go look at some news coverage and see how news differs. We on purpose split the students so that each student watched news coverage in a state-based exchange market, and then also one from a federally facilitated market to see what sorts of differences there might be. And if you all remember, the marketplace is open, but then things go wrong. And in our first initial discussion about the news coverage that was happening, we saw 2 what seemed to be distinct patterns. And so I'll contrast April Todd Malmov, who was the communications director for the Minnesota Exchange. Things don't end happily for her, for any of you who were paying attention to this. But at least during this first period, people like April Todd Malmov were going on the news and saying, there are lots of glitches. Yes, we understand, but hang in there with us because there are all these benefits to being involved in the marketplace, all these sorts of things. So there were lots of news coverage that looked like this where you'd have a state communications director on the news talking about it. And then, in what seemed to be mostly occurring in the federally facilitated markets, of course, they play sound clips of Obama and Sebelius, but they're also then sort of running out of story. And so they start covering things like health scams, right? So don't give your health information to anyone, right? Because they will take it, they will use it, you will get all of this bad information. And so lots and lots of scare tactics. And so it was on this basis that we were like, maybe there's something there. Maybe there's something that distinguishes the information that people are getting, and perhaps these boundaries of state-based exchanges where they have more people who can go on the news to combat the scare stories may be important to look at. So it was on that basis, and of course through the Wesleyan Media Project, we also had access to not only all of the political ad messaging, which in this time period is not very high, but we also had the insurance advertising messages, and so I'll talk a little bit about both of those in just a moment. But it was on this basis that we launched a pilot, and so over fall break at Wesleyan University, we hired 40 students to help us analyze the first 2 weeks of the Affordable Care Act coverage to see whether or not there was something there. We were also fortunate to get an open access publication in the Journal of Health Politics, Policy, and Law, looking at these content differences. And it turns out that the federally facilitated exchange markets were more negative in their coverage than the state-based markets. So on that basis, we then applied for funding, and we were fortunate enough to get a Robert Wood Johnson Foundation grant through its SHARE program, which was the basis for the work that I'll be talking to you about. And I want to briefly acknowledge my collaborators, Sarah Gullist being the primary, and then lots of supporting actors at other places on this work. Okay, So then, just by way of motivating, why look at Affordable Care Act messaging, right? Why should we care? And I think this is a particularly important point for political scientists. Maybe I'll have to sell you too on it, but I wanted to briefly say there is theory that would suggest that in a particularly polarized environment, that messaging may not matter as much because people have salient political cues from which they would draw, and therefore the actual content of the messaging doesn't matter. And that is a serious critique and something that we would need to deal with. But I also want to suggest to you that at least in the initial rollout, and perhaps, and I think it's unclear how far out it goes, that under the ACA, there was very, very low information about what the law entailed. So even in the opening of October 2013, Kaiser Family Foundation has these really nice information from surveys suggesting that most people don't know the components of the law. And so under the guise that information is low, public communication may matter. And there are multiple actors involved here, not all partisan, right? So of course the Obama administration and the Republican leadership have a lot at stake here. But you also have insurance companies that are trying to get people to enroll. And if trying to get people to enroll means that you also need to provide them concrete information that leads them to do so, you have powerful incentives. And the outcomes matter here, not only for the partisan actors, but also for the insurance companies, right? And they can't continue with what they're doing if they don't get people to follow through on the behavior. So for all of those reasons, I think the messaging is important to look at and has potential consequences. We've been fortunate enough to find some ways in which we think it matters, and we're continuing to do that. And so very briefly, I just wanted to outline the larger project and the scope in which we're working. The ACA, of course, is a large government investment with varying types of state-level administration that's carried out substantially through private means. And that has really important implications, I think, for the ways in which citizens encounter ACA information. It's not always going to be from a politician. It's not always going to carry the tag of Obamacare. And that has interesting implications that I think deserve further examination. So we're interested first and foremost in looking at the differences in volume from different sources and looking at those differences over time. We're just beginning the over time component, and I'm going to start that in just a moment. We're interested in looking at the differences in the content of messaging, the influence on enrollment, and that's what Sarah really talked to you about a couple of weeks ago. I'm going to move beyond that to talk about the broader assessment of the law and how messaging may affect citizen opinions of the ACA. And then I think there's this open question that I'm really interested in exploring with Colleen in particular about the long-term effects on future possibilities for reform. To what extent do citizens think of the ACA as a private or a public program? And how does messaging on that dimension in particular vary? We don't know a lot about that yet, but I hope that we will follow up on it. So for this talk, I'm going to focus on the overtime component and on the broader public assessment of the law. And briefly, I want to start with the insurance. So if we look at the open enrollment period of Open Enrollment 1, this is just a quick map showing you the prevalence of insurance advertising across the country at media markets. So one thing to note, and I think Sarah also highlighted this, is that media markets cross state boundaries. So you will have one media market will spill over into Nebraska, so it doesn't adhere to those nice boundaries. But you also see that that insurance marketing was quite prevalent and variable across the country. So you see pockets where there was much greater insurance marketing than others, driven, of course, by the insurance companies' calculations about where they needed to go, right, to get more people onto the exchange. But that was not the only source of information. And in particular, I want to talk about the differences in timing that happen over the past enrollment periods that we've had. So in particular, in 2014, there were expectations that the 2014 midterm elections would be a referendum on the Affordable Care Act. Turns out that that's not wildly the case. So it was not the case that the ACA was the dominant message by Republicans, but it was a very prominent message. And to give you just a flavor of what sorts of messaging occurred, I thought I'd quickly walk you through some of them. So you had ads that attacked particular people as being liberal lobbyists with higher taxes, more spending, and Obamacare taking away our healthcare choices, right? You have again, attacking governors. Obamacare cancels 250,000 Colorado policies. It doesn't just happen in purple states, it also happens in red states, so, or other purple states. So state premiums will rise 13.2% in 2015. It's not just used as an attack, it's often used as in the promotion of but Republican candidates. So David Jolly, Republican for Congress, I'm going to replace Obamacare, right? You see lots of messages, again, mostly with the tag Obamacare because all of these messages tend to come from Republicans. Democrats during 2014 do anything but talk about the ACA. So the closest thing, I couldn't even, in our press releases for the media project, I couldn't even label it pro-ACA messaging because the closest thing that they would get to would be something like, I stood up against insurance companies. Which for those of us in the room, okay, we know that that's an oblique reference to the law, but it's not, there was nothing that could closely resemble the kind of attacks that you saw from Republicans. And then they also got cute and clever with some analogies. So you have Obamacare is not healthy for California. And then Obamacare is a tough pill to swallow, right? And I think this one actually aired in Illinois. So what I think the open question is, what influence do these messages have? And for that, I want to provide you some additional data. But first, we have been looking at these issues. We've been looking at them primarily in the open enrollment period 1. I'm going to move beyond that today, but just quickly to highlight what we've done so far. We have found higher levels of insurance marketing measured through TV advertising do correlate with decreases on insurance rates, and that's what Sarah presented to you last time. We've also found that partisans, at least during the initial rollout, viewed insurance ads through a partisan lens. And for this, because I'm going to build explicitly on a piece that's forthcoming at JHIPL, I want to take just a moment to walk you through what we did. So looking at the content analysis of advertising, both insurance advertising, political advertising, and local television news coverage, which most people still get their information from, we combined that content with an October 2013 wave of Kaiser Family Foundation data, in which we had 2 dependent variables. These are not ideal, I wish we had more, but we did have a measure of perceived information. So how do you feel you have enough information about the healthcare law to understand how it will impact you or your family? And then given what you know, right, standard question for Kaiser, do you have a generally favorable or generally unfavorable opinion about it? So what we did is we had also on the Kaiser survey, we didn't have measures of media consumption, which is a problem. But we did have measures of how much citizens reported paying attention to domestic policy issues. There was, in particular, a question about the ACA, but it focused on how much you're paying attention to the technical glitches of the ACA, which was more, the people who were more likely to say they were likely to pay attention to that were Republicans. And so we were a little bit worried about that partisan difference. So we ended up looking at self-reported attention to domestic news. And then we create an individual measure of exposure by multiplying that by the message volume. So if you pay a lot of attention to domestic news, you will get matched to all the ads that aired or all the news content that aired in your particular market. If you pay attention to it about half the time, you'll get matched to half, right? So it's an individual measure, not a market level. And that has been validated in the communication literature as being a decent proxy for consumption. So if we do that, what we find, interestingly enough, during this October 2013 period is that your exposure to insurance advertising does tend to correlate with favorability towards the law, but that it's also moderated by your political partisanship. And so to show you that graphically, because I think it's easier to see it here, on the y-axis you have predicted probability of being very favorable towards the ACA and very unfavorable towards the ACA. Blue is Democrat, red is Republican, and green are the independents. And so as you see, as insurance exposure increases, you see Democrats being more likely to be favorable toward the law. In other words, during this period, the more Democrats are seeing the insurance advertising, the more they're cheering on their party, right? Oh, the ACA is really working. We see that it's really working. Whereas Republicans in particular, but also to some extent independents, the more they see ACA insurance advertising during those first couple weeks of October, the more they're saying, there are all these glitches and they're still advertising for it, right? And they decrease, that there is a correlation between their view of the ACA. Okay, so that's the basis. But political ads, right, during this period do not correlate with any of those things. However, in October 2013, there were very, very few political ads on air. So to show you that, there were an average of 20 ads per market compared to an average of nearly 420 for insurance ads. And for the full enrollment period, you can see this is that same graphic I showed you before, and here's the comparable graphic of political ads that are mentioning the ACA, right? So, and with the key here being that this goes to a total maximum of 4,000, whereas the dark colors over here are 20,000. So the insurance ads are really swamping out the political coverage. Okay. That's not true for all enrollment periods. So here's my little graphic of the timeline. So you have open enrollment period 1 on the left here. This is the in-between period in which the 2014 midterm elections occurs, right? Open enrollment period 2 opens just after the close of the midterm elections. And you have the blue line showing you the volume of insurance advertising. So you see, not surprisingly, that it picks up during the open enrollment period, drops off in between, and then picks up again. And then you have political ads attacking the ACA in the yellow line. And so here's open enrollment period 1, right? And you see in the comparison in volumes. If you look at the period just prior to open enrollment period 2, you see this vast spike, right? So political ads attacking the ACA are occurring precisely at the time that the insurance ads are moving forward.
Now, these don't include the ads from the exchanges? This is just the private insurance companies?
No, they include all ads. So thank you. So the insurance advertising includes anything that could be possibly conceived as an insurance message or an exchange message. So the state-based exchanges, the HHS advertising. There were even in here some local television news stations advertising their information about the exchanges. So we had to figure out what to do with those. But yeah, so it's everything that could possibly count. This is especially true that there's this large difference if we look at what I'll call contested battlegrounds and battleground states here, which is slightly different versus the non-battlegrounds. So if we look at, in particular, the 2014 Senate battlegrounds, which are those plotted in blue, and the yellow line here is parity. So if we were to look at, so things below the yellow line here are where political ads are dominating, whereas above the line are where insurance ads are dominating. And so you do see differences here, but in particular in the contested states, you see larger amounts of political advertising swamping some of these places. Okay. And then if I show it to you more graphically and geographically, if we take the difference, so in the yellow-orange color, our insurance advertising is more common, whereas the green color, our political ads are more common. You see that there are markets in which, even if we include the full open enrollment 2 period, there were more political ads attacking the ACA than there were insurance ads about that. So what are the consequences of this? And it's that piece that we really want to explore here and try to determine. So I can demonstrate to you that there are empirical differences between markets, that there's geographic variation in how that happens. The question is, what are the effects, right? What are the consequences of these? And I can also demonstrate to you that open enrollment period 2 is substantially different than both 1 and 3. And if this election cycle, right, so the reason why this is relevant right now is because we're approaching election season again, right? And you are starting to see, in particular, Republicans bringing up Obamacare as a standard, you know, like I'm a conservative with conservative credentials, right? Highlighting those messages in ads. And so open enrollment period 4 should look much more like open enrollment period 2 than 1 or 3. So how does this matter? Theory and evidence suggest that citizen prior exposure to information should matter. And so we want to get a sense of how this may matter and try to get a handle on what the influences are. So in terms of expectations, clearest set of expectations is that political ads, more exposure to political ads attacking the ACA, should decrease your favorability of the law. That should probably be moderated by your partisanship, but it's an open question. And in particular, the areas that have been heavily targeted by the ACA insurers, right? So those target areas for the ACA where all the insurers are going in and battling it out might respond differently because they've seen a lot more messaging about the ACA prior to election period. So here's what I'm going to do. We are going to look at an SSI survey sample, which is designed to be nationally representative, but maybe not as good as, say, a Kaiser survey. And I'm going to look at that one in particular because it has decent sample size, but it also has this ACA favorability question. It has most of the same demographics that we had in the Kaiser survey, including health insurance. The only difference is that there's no self-reported. I don't have a measure of how healthy an individual sees. But I'm going to use the same measures that we used before in the JHIPL piece, including attention to the upcoming enrollment period by this market level volume of advertising as my proxy for exposure. And I'm going to control for some other county level characteristics and also some market level characteristics, so the extent to which the ACA marketing has already occurred in this particular place and the total number of political ads. And I'm going to show this to you a couple different ways, but just walk you through it. So first off, the individual estimate for exposure to political ads has a corresponding sign that makes sense. So as political ads, as your exposure to political ads about attacking the ACA increases, we see corresponding decreases in favorability. If we just control for whether or not the market is an ACA targeted market, right here this is just an indicator variable, so I split them at the median. So, or I'm sorry, at the mean. So those markets that had higher than average open enrollment insurance advertising in open enrollment 1, we don't find a correlation between favorability. We find in the demographics some encouraging things. So as you're more Republican, you're less likely to be favorable. That makes sense. This is a particularly sad one. So if you don't have health insurance, you're also less likely to be favorable. But then I'm also going to take the ACA targeted market and I'm going to interact it with the exposure to see if there's a difference. And what you see is that the main effect goes away for political advertising, but I pick up this very strong negative effect on the interaction. So to quickly show you that graphically, what that is saying is that so on the x-axis, as political ad exposure increases, only for those that are in markets that have seen a lot of insurance advertising in open enrollment 1, we see this very strong negative influence. In other words, that the more exposure they get to political ads in those particular markets, the more likely they are to be unfavorable towards the law. That doesn't exist in the markets that didn't see that strong before.
How do you deal with this sort of potential endogeneity that if I have 7 different political ads I could aim at you, if you hate ACA, I'm going to make the ad that aims at that. And so some of this line is reflecting that the people designing the ads are running a lot of ACA things in places where they think people hate.
So this is political ad exposure that mentions the ACA. So I can't control for the differences in content in the way in which they're talking about the ACA, but this is not, and I am controlling for total number of political ad messages. So there's no, I don't have it on the graphic here, but the control for total political advertising messages is insignificant. What seems to matter is the extent to which the volume of the anti-ACA attacks. Does that answer your question?
It seems like putting a causal.
Oh, I agree. I can't say anything causal here. So if I've done, I should be using correlational language. Yeah. To say anything causal, we'd have to have we'd have to have an experiment. And even then, right, we have issues with generalizability because there is endogeneity in all of these, right? So there's endogeneity in the places in which the insurers are going in, and then there's endogeneity in the places in which the politicians are, in particular, talking about the ACA. Yeah. Okay, so I think this is interesting. I'm not sure that I believe it yet, so I welcome your comments and criticisms and other things I should look at. but I want to complicate it just a little bit more than I already have. So during the week prior to the SSI survey, if we look at that, here on the left are insurance ads, and here on the right are political ads. So it's not as if there are no insurance ads on air during this period in very late October 2014. There actually are quite a few insurance ads on the air. And so we might think that that maybe is important to keep track of too. The bolding on the right here is just for a contested Senate race. You can see that there are markets where outside of those places there are a lot of political ads that are attacking the ACA, and that's because we're counting all races, not just Senate races. So these are congressional races, these are gubernatorial races. And so in those markets, though, where we have high levels, so it's not the case in Nevada, because you do see some here, but in high-level markets, it does usually tend to be the case that there are fewer insurance ads. And that's because political ads in late October 2014 are swamping out the competition. So most insurers have trouble getting on the air. In fact, if I were to correlate at the market level, political and insurance advertising, there's a 0.05 correlation between the two. So in general, no correlation between the two. So what happens, yeah?
Are these absolute number of ads? It's not relative to population or per capita measures?
These are absolute number of ads.
A market like Chicago, 7 million people,
Yep.
is going to have a lot more ads than a sparsely populated area by definition. And so isn't there some need?
Why by definition?
Well, because there's a bigger market there.
There's
one ad is going to cover 7 million people. And here, and in Wyoming, one ad is going to cover 20,000.
Yeah. So the number of impressions are a lot smaller, but there's equal airtime in Wyoming as there is in Chicago, right? So we're counting the total number because the number is also important. If you turn on the television in Chicago, right, even though there are many more people watching it, there's only so much airtime to which you can be exposed, right, to those messages. So yeah, I mean, it is important to recognize that marketers and politicians will be strategic about where they place their ads based on population. But I'm not sure that we need to adjust for that in the individual models. I think it actually matters if you're seeing wall-to-wall anti-ACA attacks versus very few. Okay, so this is the same model that I showed you before, but now I'm going to add in your potential exposure to insurance advertising. And keep in mind that these two measures right here are not correlated at all. They are correlated in the extent to which an individual is likely to pay attention, but they're not correlated in the volume measures. And what you see is that we pick up this insurance advertising. More exposure to insurance advertising makes you less favorable toward the law, which is not necessarily something that I would have predicted initially, right? So it gets even more interesting than that. Let's add in the interaction with these targeted areas. And you see in both cases, so I lose the main effects on both the political ads and the insurance ads in this interactive model. But in both cases, for political ads and insurance ads, I get this negative effect. So more exposure to political or more exposure to insurance advertising correlates with more unfavorability. And so here's that plot. So again, it's estimated exposure to ACA attacks in political advertising. So as that increases in places that have seen a lot of insurance ads in Open Enrollment 1, we see this decrease. But also then in the colors here, I have low levels of current insurance ads, high levels of current insurance ads, and you see this corresponding decrease. That does not appear in the markets that have seen a lot of insurance ads in Open Enrollment 1. So I find this really interesting. I'm curious to hear your explanations. It seems to me that it may be an issue of timing, that there may be something about in the heat of election season. And the thing that I'm not controlling for here yet, which is very important and should be in the model, I just didn't have time to put it in yet, is news coverage, right? And so the extent to which the news are covering the ACA may matter, and maybe that takes care of this odd finding for insurance advertising. But I do think it's really interesting, and I think it's potentially important. So political messaging, may matter more during the heat of election seasons, but maybe it's something about the timing. And in other words, if it's something about the timing, I mean, what that suggests to me is that for insurance advertisers, perhaps they want to stay away from being on the air during the heat of election season when people are more likely to be viewing this through a potentially partisan lens. I did just quickly check for interactive effects with partisanship. There's no interactive effect in the political model. In other words, for all types of partisans, the more political attacks they see on the ACA, the less favorably they view it. There's an interesting interactive effect with the insurance ads, and I think it's that piece that we need to explore more. But of course, so the needed next steps and the things that we will do immediately are try to replicate this with other survey data sets. So in particular, there are Kaiser surveys during 2014, October and November, that we'll look at. There are a couple Pew surveys. I know I need to add in news coverage and then further investigate the content of the messaging. But I'd love to, and this is where I'd love to hear your thoughts and comments and contradictions or things that you think we haven't done. But with that, I think I will open it up for questions. Yeah.
So there are now an increasing number of markets in which it is expected that there is going to be either no or very little competition between insurance companies in the ACA.
Mm-hmm.
How would you expect that to impact the market?
Well, so in places where you have more of a monopoly on the insurance, you should expect to see fewer ads. So it's not the case that the insurers will disappear from those markets. They should still be advertising on air because their primary goal is still to get people to enroll. But you should not expect to see as many ads on air, right? So the places where you tend to see the most advertising is, of course, the places with the most healthy competition between insurers. I did read a news report about Aetna, and then there's one other insurance advertiser who will be going into some of these places where United Health in particular has dropped out. So that should help with the messaging, but I do think there is, you will see fewer messages from a diverse set of people. I'm not sure it means that the messages go away.
But so with fewer ads, given what the impact that you were finding of insurance ads,
Mm-hmm.
making the ACA less popular, with fewer ads, are there going to be an increase in sign-ups?
Increasing signups. Well, I think, so the problem with the enrollment question, right, is that there are so few people. So the advantage that I have in this particular set of analyses is that everybody can have an opinion about the ACA, right? But in terms of trying to determine who the actual enrollees are, that's a much harder question because there are fewer people to sign up. So far in our first set of analyses from open enrollment period 1, it does suggest that you have more people. The more insurance advertising you see, we do tend to see a correlation with decrease in uninsurance, right? But how that plays into the differing sources of the messaging is an interesting question that I'm not sure we can adequately get at.
What was the actual question for favorability? Did it say Obamacare or?
No, it's the same question that was asked in the, I'm sorry if I didn't have it on here. It's the same question that was asked in the Kaiser survey. The only difference is that it's so it's given what you know about the health reform law. Do you have a generally favorable or generally unfavorable opinion of it? The only difference is that the Kaiser survey, it's a 5-point scale, and on this one there's a 7-point. So there's actually a little bit more room to be very favorable or very unfavorable.
And do you know the sponsorship of the insurance ads? So as you said, some are coming from the state just about the marketplace.
Yes.
Sign up.
Yes.
Or from the federal government, healthcare.gov. And obviously there's a good number coming directly from private insurance companies. Do you
Right.
have that breakdown?
I don't have that breakdown here. I don't think I even have it in the supplemental slides, but we do have it. So I could tell you exactly how many are from each particular source in each market. Do you think that that we should check for differences across the insurers in sponsorship? Is that what you're suggesting?
Yeah, I mean, I just wonder, it's kind of getting to your point about content, wanting to know about the content.
Yeah.
And I don't know that I'm right about this at all, but I would, in a little bit of looking that we had done for the other thing, but
Yeah.
almost kind of undermining the role of the state and
Yes.
public insurance. And so people, what's interesting is they might answer the, so because the people answering this question are also not knowledgeable, right? We know that to be the case.
Mm-hmm.
And so when you say, are you favorable or unfavorable to healthcare reform, they could say they're unfavorable and still be exposed to a private insurance ad, not necessarily knowing
That it's connected. Absolutely.
right?
Absolutely. Well, and to further complicate that, and this is why I think the question about the public versus private references is really important, and we've got to look at it, is so this is a Access Health Connecticut, so state-based exchange ad in which they're touting name brand insurance. So they're explicitly touting this private reference.
Right.
And then you have, this is a Nevada state exchange ad where they're talking about purchase state-approved health insurance plans, right? So there's variation in the way in which it's sold. So this is Blue Cross Blue Shield, I think, of North Carolina. And they're saying, you know, they're touting it's less than $110 a month after subsidy, but note that they don't ever anywhere tell you that it's a government subsidy, right? That it's after subsidy. So I think there's a lot of variation here. And I think that's why we could look for the sponsor effects, but I'm not sure, I think it's more of a content effect. Yeah. Yeah. So it's a lot more complicated than we give it credit for. Yeah, I'll start here and then a couple more.
So I have a question about the measure.
Yeah.
Which
Which one, the exposure?
No, sorry, the outcome. Just the question of
The outcome.
favorable or unfavorable. I mean, you know, it's funny because now you'll see these polls that say most people disapprove of the ACA, but it's not necessarily because they're against it per se. Some portion, especially the left wing, doesn't think that there's small harm in it.
Mm-hmm.
So I wonder how much of this lack of favorability is we really don't like it because it opposes my fundamental conservative credentials or whatever,
Right.
as opposed to it doesn't go far enough.
Yeah, no, I think that's a good question and not one that I can untangle with these data. I wish that I had pulled, so I was doing a little more investigation of the Kaiser trends, right? Because they've been asking the same question since well before the law even, open enrollment even started. And what is interesting, and I think perhaps somewhat encouraging to me in terms of this particular analysis, is that you tend to see unfavorability start to rise during election years and then come back in, right? So there is something about the priming and the way in which citizens are viewing it during these periods, but overall the numbers have been pretty stable. I mean, like, there is movement, but I think the overwhelming trend is a lot of stability in those numbers over time.
So I just wonder if it's, if it goes back to the idea that all there's no such thing as bad publicity. So this is what I said. If it's on people's minds, you could imagine that the people who don't like it for various reasons are more likely to think about it.
Mm-hmm.
And find.
Mm-hmm. Right.
So you might still see stable trends, but without being able to really dive down into what is the reason, if you don't like it, it's kind of hard to. To me, it's a little hard to interpret.
Yeah, no, I totally agree, and I also think, and the other consistent thing that we know is when it's mentioned as Obamacare versus the Affordable Care Act, right? You see more polarized opinions, and that's the other thing in terms of the messaging that you're seeing just prior to being asked probably matters, and the extent to which you can connect it, right? So an Obamacare reference, would you connect that to healthcare reform? Probably, but some of the other ones maybe not.
I probably have the same comment that Tommy made in kind of a different frame, which is, many of us are just concerned with getting the message to the uninsured, which I think of as a completely different set of people than the people who are targets for political messaging.
Yeah.
And I also think, the insurers, and even, I produced a series of ads that were targeting a county-based Medicaid program with a lot of sophistication behind it in terms of understanding who the audience would be, what the placements would be. And it was a pretty razor-sharp, if you really believe in advertising, which I do, then it was a pretty razor-sharp set of placements and messages that were tested and refined, which is completely divorced from, what you would do if you're again, most of the insurers had enough sophistication to do that really well. So anyway, it's we believe advertising works, which I think we both do. It's, you know, and I think content then becomes such an important question for the questions you're asking.
Yeah, no, I fully agree with you. I think the content matters. There's a lot of nuance to it, and here would be my one pitch back to you about why I think the larger population matters, right? So if we believe that the ACA was intended to be step one and that it's not done, right? We should probably also care about the extent to which people think that it's working or that they would be willing to do more. And so I think in that sense, like the larger population is not the target of the insurance advertising. I fully grant that, but they're not the only population seeing it, right? And they're not the only population that is being targeted with messages about it. And so I think it's that reason why the larger population is of interest, and why I think it's interesting to me. I fully grant the enrollment question, because that's obviously fundamental to the health policy folks in particular. But I also think there's these interesting additional dimensions that are worthy of exploration. But I hear you, and I'm right with you on the content exploration, because and that's the funnest part, to be honest, right? Because they're so different in the way in which they sell it. Just on the marketing side alone, like forget about the political ads, which are also, I think, really interesting.
They're all good. They're all closed, right? Yeah.
Right. Yeah. Exactly. Yes.
So this is related to some of the other questions, but did any of these studies actually break down what they thought was unfavorable? Like if they felt the insurance coverage was unfavorable, if paying a certain amount per month is unfavorable, like if they just didn't know enough about their coverage to have a positive or negative view on it?
Yeah. So Kaiser does some of that, but I think the underlying problem here is simply citizens' lack of knowledge about what it is, right? And so, and I think it gets back to the other comments too, that these are largely driven by partisan perceptions, and so you may or may not need to know anything about the law in order to say that you have an unfavorable view of it. But I do think that those reasons are important and should be explored further. I don't have, in this particular data, I can't get at that, but in the Kaiser data, you can try to pick apart what it is that they don't like about it, although I do think that it's still large numbers of people I don't know that they know why they don't like it, aside from the fact that their, party worldview suggests that they should or they shouldn't like it.
Erika, do you have favorability measures just for the uninsured subgroup?
Yeah, I could break it out. The uninsured are only, I don't have them on a slide or anything that I could tell you. The uninsured are, oh shoot, and I think I had a sample that I think I forgot. I did have a quick breakdown, but the uninsured are about 10% of the sample, so it'd be a very small subset. But they are more likely to be unfavorable compared to the general population. Yeah, so this was the sort of somewhat says, so this was the finding that made Sarah most sad. She's like, no, no.
Are you controlling for, I see you have your other, you have income.
We have income, we have education, we have race. The only thing I don't have from the J. Hipple model is self-reported health status. So I don't have the extent to which you feel healthy at the given point in time.
I mean, isn't it fairly reasonable for people without health insurance to be unfavorable, because these are people who are finding it unaffordable, even though the Affordable Care Act is out there?
I mean, I think
that would be a good reason to not be favorable.
Right, I agree. Yeah, I haven't seen, I'd love to see that particular question, like how affordable, but I think that, in all of these cases, it's driven so much by your partisanship that I don't know, like Democrats, you find a lot of partisan cheering. The more explicitly you connect it to the partisan agendas, the more partisan cheering you will find. So Democrats, even if they did think it was unaffordable, are going to be more likely to say that it is affordable.
But you're controlling for it.
Yeah, I'm controlling for it here. Yeah, yeah.
And why, so I assume you didn't
I just didn't have, so we have to go to Kaiser to get the media market information. And so I don't have that yet. So we just you have to apply. It's not hard because we did it for the other piece. I just don't have that data in-house yet. Whereas I did have this survey available. Oh, and the other benefit to this one, so I don't want to throw away this analysis. We'll try to replicate it across other data sets. But the one big advantage that this data set has that Kaiser does not is that I have independent measures of media consumption. So I can go back and make an exogenous estimate for exposure that's not tied to individual attention and see whether or not the results hold up in that. Because it has questions about how often do you watch television from 7 to 10, and how often do you watch during 10 to 4, and so I can create a measure of estimated exposure that doesn't have anything to do with your attention. Which I think is desirable and interesting. So.
And does Kaiser ask, because in some of their health tracking studies they use the term Obamacare versus healthcare, so I wonder if you're also able to kind of pick up on the ways in which we ask about favorability and whether your results might
I don't off the top of my head know how they asked it in the 2014 waves. I do know that in January 2014, so I don't know the later half of the years, but January 2014 and March 2014, for which we also have the local television news coverage already coded and ready to go, they did ask it in those multiple ways, and they had better dependent variables than we've used so far, including some more objective measures of information. And so we so this content coding of local television news is a massive undertaking, and we just finished the coding for the weeks prior to those surveys. So we will be working on those sets of analyses coming up hopefully this summer.
Yeah.
But yeah, I don't have them yet.
It might be interesting because Kaiser also asks about favorability towards the medical extension.
Mm-hmm.
And I just wonder if it might be interesting to look at, arguably, the political ads aren't targeting Medicaid. Maybe some of them are, but most of them work broadly about Obamacare.
Right.
Because that's too specific for a larger audience. And even so you had insurance ads targeting the Medicaid expansion, but a lot. So I just wonder, again, it might be interesting to look at, do you see these effects across all different types of questions, or so is it just a broad-based spillover effect? It doesn't really matter what you ask about.
I agree.
Or not, or maybe it matters. I don't know.
Right. No. Yeah. I agree. And I don't even know. I would assume that there's a large correlation between the two, but I haven't looked at that data at all but I fully agree that expanding the set of dependent variables.
Yeah. There is a difference in how people, at least in the data we've looked at for the Kaiser health tracking poll.
Is there?
People,
are less or more favorable?
I think they're more favorable
Interesting.
to
The Medicaid. Okay. Interesting.
And clearly varies by race, the typical things, but
Right. Yeah, I agree.
So part of what you're showing here is that it's pretty easy to change people's minds. I think about, and this is like kind of consistent with like all the stuff that says, oh, the majority of Americans favor single payer. Then when you actually ask them, would you be willing to pay more taxes on it, almost down to 20%, right? And so I think my question is, to what degree does it? I don't know exactly how to put it, but how much does it matter what people actually report what their view is about the ACA? Given that it seems like it's liable to kind of change with relatively little manipulation.
So the thing that I would say, I don't know, certainly not with these data can I demonstrate to you that people change easily, because they are this is a single cross-sectional survey. I don't have panel data to be able to control for prior opinion and to suggest to you that it does change in the wake of messaging. So I want to be careful about going too far in that line of reasoning, right? I think what I can demonstrate is that there are geographic differences, right, and individual differences in the ways in which citizens appear to be doing that. But I think it's not, I don't have adequate data to be able to say that, you know, strong Republicans or strong Democrats, which I don't think we should have expectations that they will dramatically change in the face of information, are really pliable. Does that? Yeah.
I can only draw on a layman's view of political science and advertising, but I'm trying to figure out a theoretical frame that helps explain this, and I'm struggling. So what I started thinking of in my head is what we know about negative campaign ads versus positive campaign ads. And it seems like, you know, in my memory somewhere there's this idea that if I run an ad that said Colleen is a horrifying human being, and it doesn't matter what Colleen does if she's got an ad saying, look what a wonderful person I am, unless Colleen directly addresses the attack that's been made on her,
Yeah.
or whether Colleen directly goes after the attacker.
Yeah.
Right? Does that sort of knowledge, that sort of theoretical base help explain your findings?
Yes, I think so. I mean, yes. So it's the competing messages theory, right? So John Zoller in particular has done a lot of theoretical work suggesting that one of the reasons we don't see a lot of effects of political advertising just generally is because in competitive elections we tend to see two-sided messaging, and in those places the effects will cancel each other out. On the ACA in particular, in the political sphere.
I thought the story was it's not just that they cancel each other out, that you can drive some of these favorability ratings down much more easily than you can build your own favorability ratings up.
Yes, that's universally true because negative information is more memorable than positive information. But that's also combined with the extent to which you are countering the opposing messages on air, right? So you will have a much easier time driving up unfavorabilities than you will driving up favorabilities, right? So the positive information is a lot harder than negative information, in part because we as humans remember the negative information more than we do the positive information.
So in this situation, we have negative ads, Obamacare bad, Obamacare bad, Obamacare bad. But the other ads, the other content ads are not saying
Correct.
people who say Obamacare ads are bad are evil. Don't believe them.
No, right.
They're just saying.
They're saying something else. They're saying, you know.
Shiny over here.
Yeah, so you have it on two dimensions, right? Because you have the Republican anti-ACA attacks explicitly going after Obamacare. You do have Democratic messaging, like in the political world, trying to counter that, but countering it with different messages. So not the ACA.
I mean, that was your point.
Exactly. Exactly. So you have it on the, that's exactly what I'm saying, is that on the political world, you have an uneven message on the ACA. The insurance advertising finding, though, is still a bit puzzling in the extent that they're explicitly selling it. But this is where I think the answer may lie in news media coverage around the election, right? Because even though empirically through the political ads I can tell you that the ACA was not the top message, I don't know that that stopped news media from covering it as such. And so if the overwhelming narrative of the period is that Obamacare is a big issue and lots of people dislike it, then I don't know that that further piles on to the Republican message that drives down opinion. So yeah, I'm agreeing with you in that vein. Yeah, Harold.
One of the ways that it was interesting in the off-year election, I think ACA was just, Democrats just did not talk about it, and this dynamic is very much the way we've been talking. The most effective way to defend ACA in some ways was kind of a hybrid of what Curtis was talking about, and something more where like Mitt Romney believes very strongly that he lost a huge chunk of the Hispanic vote because of ACA. He thinks it was worse than immigration as far as his own. And one of the ways that Democrats very effectively defended ACA against people like Mitt Romney is by linking it to stuff like the 47%. And there's the saying, what you say about your issues is less important than what your issues say about you. And basically, you could say, here's this guy. He's against health insurance for people, just like he's against giving food stamps to people. He's against helping people who need help. And you can put it in a frame where it becomes characterological, where the attack on ACA is characterological I think that, but it's a lot easier to do in a presidential election than it is in an off-year election, to sort of pull that one off.
Yeah, I think that's right.
Can I go back to this disappointing to the two you and Sarah finding?
Yes, please.
So, there is, again, as a political scientist, that there is the evidence and perhaps theory out there saying why people vote against their, what
Self-interest,
we
right?
assume to be self-interest.
Mm-hmm.
I mean, can you reflect on those findings a bit from that perspective?
Yeah, I mean, I think that, you know, and I don't, and this is where it would be nice to have more information on why they don't like it. But I would presume that the people who are uninsured at this particular point in time, you know, perhaps some of them have looked for insurance and still find it unaffordable, right? And that is very likely, I think, to drive unfavorable perceptions. And so I think it may be something along those lines that may be driving it. I don't know. I'd welcome your thoughts. Do you have other? Yeah, yeah, I agree. Sarah was that it's the other way around, right? They're unfavorable because they're uninsured. They're uninsured because they're unfavorable. So, yeah.
I think a lot of people don't like to go to the doctor unless they absolutely have to. So probably anybody that feels like they're now forced to pay for it, but they're not using it, is probably viewing it unfavorably. So is there anything in the data that allows you to control if they've had to go to the doctor for any reason or hospitalizations, anything like that?
Sadly, not in this data set. But Kaiser Kaiser at least has the self-reported health status, which helps. And we could look for, if you know of any, I don't know of other data sets that had the favorability question and those other things. Pew, what? We do have age. That's true. Yeah, that's a good idea. So maybe that's the way to try to get at it. Yeah.
I'm just kind of curious about how different periods in which you might do this study, the circumstances are absolutely different in terms of where people are coming from. I mean, the thing I'm thinking about is that when the ACA first came out, maybe a lot of people didn't know that they were going to get a tax penalty at the end of the year if they didn't get health insurance. And so the first year, it's like, whatever, it's like $70 or something like that. But by now, it's like $700.
Yeah.
So I almost wonder if people are coming from different levels of baseline and how that interacts with all of
Yeah, yeah. So I'm so glad you mentioned that, because that's what I've intended to say. That so students in my equivalent class this year were really interested in that question in particular. So they took a sample of open enrollment in period 1 insurance ads and open enrollment period 3 insurance ads. And the biggest difference that they found in the content is this selling of fines, right? So fines are much more prominent in open enrollment period 3 than they were in 1. And then they followed it up with a experiment. So they created their own insurance ad in which they highlighted different features. So it was affordability, fines, and then like personal risks or accidents. They didn't find any differences. So it didn't matter which ad they exposed the respondents to on the favorability question. But they did find perceived information increased when they were exposed to fines. And so I think that's interesting. And that's also more negative information, right? So if you look at the insurance ads for this year's like in the lead up to this year's open enrollment period combined with the political ads, it's more negative information about the law potentially, right? So if we believe that the negative information not countering each other or potentially piling on, it could be worse for open enrollment period 4 in terms of perceptions. Yes, I'm so sorry I missed you before.
Okay. So Curtis has emboldened me to do political science. So I want to talk about the insurance targeting that happened in open enrollment period 1.
Yeah.
And how the makeup of that might look different than subsequent insurance advertising.
Mm-hmm.
I'm specifically interested in sort of the state-focused or the state-generated messaging,
Mm-hmm.
and whether there's difference between the above-average this is state stuff, this is government stuff. So even though you're hearing messages from Aetna or Blue Cross or whoever, in subsequent times, what they're hearing is they're hearing government. And maybe that's what the difference in the reaction is, if there was a difference in that at the beginning. So it's this reaction to the state content.
So the state exchange ads in particular, you think are priming perceptions of government?
That's what I'm suggesting.
Yeah, yeah. So I think, and this, the only I mean, I agree, and I think it's a really interesting question. The only evidence that I have at this point is still anecdotal because Colleen and I need to find some funding to follow up on it. But I do think, you know, like the names are not obviously government names. Like if it's the Department of Health and Human Services, that should be more likely to be explicitly attached to government. But Access Health Connecticut doesn't strike me as something that people would automatically know is connected to the state government. And when they're touting name brand insurance, that seems to me like they're explicitly selling the private aspect of the exchange rather than the government aspect of the exchange. And so I don't know. I mean, I think, yeah, I'm more inclined to believe that the content of the messaging here matters more than the sponsor. Now, having said that, in the political ad environment, we know that sponsor matters, and people do pay attention to the sponsor. So I guess then the question becomes, to what extent do people actually connect the state exchange with government, right? So do people, if I give you Access Health Connecticut or Insure, you know, Connect, right? Do you, as a resident of that state, understand that it is a state-based program or not? And I think that's more of an open question than, or at least, I don't, yeah,
Well,
you have evidence to the contrary.
Again, just without any specific knowledge about this, I mean, a lot of the messaging in the run to the first open enrollment period was around, you know, Obamacare, government takeover,
Right.
Those kind of things, right? So having that coupled with an increased volume in insurance advertising, I don't know. I mean, I don't know if there's a way to pick that out. The survey stuff.
Yeah, well, and I can also tell you, so my students who did this open enrollment 1 versus 3 content analysis found that references to Obamacare were really, really low. And even references to the Affordable Care Act were fairly low. In other words, and I think this makes some sense, right? I mean, it makes sense to me from a political ad perspective that, you know, political ads don't tout partisanship for the reason that they're going for people who they want to be swing voters in the middle, and they don't, you know, that the partisan angle isn't the most important. It seems like that translates to the state-based exchange too, that if you believe that citizens don't always like government, which they don't, we may not want to tout that as the primary selling point. So I agree that it's important. I just don't know, you know, I would like to see more data on what the content say. Yeah, and there's really interesting variation in the way, I mean, I think to some extent, it really matters the way in which it's sold, and states took different approaches to this, right? So Nevada clearly thought it was important to, you know, sell the state-based exchange, and does that have differences for the way in which people view it? Probably. So I think maybe the way to get at it is the geographic, taking more advantage of the geographic variation here to see how that matters.
I don't have evidence for this, but I think people generally view insurance companies negatively.
Mm-hmm.
But they view Blue Cross differently, I think. But I wonder if you have different results in markets that are dominated by Blue Cross, like Michigan or Alabama, where the messages are coming from Blue Cross and not from insurance companies. And I would suspect you get slightly different results.
Why is that pricing Blue Cross doesn't suffer from negative?
I think it's always had a
have data on it, but I do think, I mean, credibility of the sponsor always matters, right? And the extent to which,
But can you go back to states like Michigan, where Blue Cross is so dominant, or Alabama? There's several states where they're just
I'm trying to
absolutely
measure the
dominant.
characteristics of the market a little bit more specifically.
Right.
Interesting. Yeah.
right, I agree.
Yeah.
Yeah.
What in the study your students did, where they found fines are making a difference, that, you know, I suspect whenever the insurance ads mentioned a fine, it was clearly attached to the state.
They actually did it on a Blue Cross ad. So the sponsor didn't vary. So,
No, what I mean is,
oh,
it
sorry.
was clear perhaps in the content of the ad that the person imposing the fine is not me, the sponsor of the ad, but it's
Oh,
the state, it's IRS,
right,
right?
right.
IRS will
I see what
throw
you're
me a
saying.
fine.
Right.
I don't know if that's true, but I suspect that's true, that they would want to be very clear
I
where
would,
the fine is coming from.
yeah,
And and again, sort of you can see the link then to unfavorability, right? That's sort of
Right.
Obamacare is the state, the fine is the state.
right.
Whereas the subsidies, which might be the other thing that they would try to sell in open enrollment, they would kind of implicitly might try to claim
Hide the
as
role of
well,
government.
as you
Yeah.
are seeing here, right?
Right, exactly. Yeah. So I see, I'm sorry that I misinterpreted. Yeah, so like coding for the explicit attachment of government versus hidden government as being attached to those two sources. Yeah, I totally agree that would matter. And I think in their particular experiment, I think it just said avoid a costly fine. I don't think they actually primed government, which may be the reason why you don't see an influence on unfavorability, but that's an interesting, it would be nice to do the follow-up, right, to see, yeah, and or to ask about, you know, like where the fine comes, where citizens think the fine comes from.
I'm just thinking this larger story. It's such a paradoxical story where you have this law, it's been passed, it's becoming more and more embedded in America. You know, it's really at this point not going anywhere. It was helpful to the Democrats in maybe 2 presidential elections, maybe in 2016. And it also helps the Republicans in in their objectives. And it seems like every sort of the popularity and the unpopularity of this law in the right way matters so differently in different contexts that I'm wondering, it's hard to sort of look at public survey data and take away from it to exactly understand what, sort of get back to your earlier question, what to make of it, because it seems to me that at this point, like if you ran against, you can criticize Obamacare and get a lot of people brought up with government bureaucracy and so on. If you actually were saying we're going to take away health insurance or whatever, presumably would be a disaster.
Right.
Yeah, Kentucky leading, and all of these stakeholders, like the insurers and so on, that are now part of it. And it's just such a strange story where it hasn't, it never really brought any political benefits to its major backers. On the other hand, it has happened and it's a triumph in its lumpy way.
Right. Yeah, no, I really agree. And I think there's evidence to suggest, I can't remember where the story ran, but there's evidence to suggest that people are actually liking the ACA as long as you don't call it Obamacare, right? And so I think part of what we're seeing is that it is politically expedient for Republicans to keep using Obamacare as this, it's become less, I mean, the ads that I'm seeing now, that are airing right now, tend to not, it's not even, there's nothing about the content of Obamacare. It's just that Obamacare is this, you know, instant litmus test for, are you a true conservative, right? So it's almost becoming a replacement for ideology in that way. And so it's less, the political messaging right now is less about the actual substance and more just about, you know, this is my card-carrying credential of being a conservative.
Or sort of a mobilization message rather than a persuasive.
I think that's right. I think that's right.
Strategic one is important too, which is that you can oppose the Affordable Care Act, and nonetheless, your ability to advance an argument that says that we should take it apart or take it away
Right.
is good. You can oppose the war in Iraq
I think that's right. I think that's right. And probably why most of the Republican messaging is about replacing it rather than necessarily repealing it. I mean, repealing still exists, right? But I think you're seeing more messaging about replacing.
All right, well, thank you very much.
Thank you. This has been really helpful.